and hit record so that we start recording the session. And then while people are coming in, we do have a few questions for you just to get to know you a little bit better. So I'm going to start the first poll. So you'll see a question come up on your screen. What is your child's age? You can select more than one answer if you have more than one kiddo. And this will just help our presenters tonight to get to know our audience a little bit better. Again, we can't see you, so this is just helpful for us to know who we are talking to tonight. And I still see people are joining us, so if you have any questions, go ahead and put them in the chat box as well. And I'll give it a few seconds. I see a lot of people responding to the poll question, so thank you for doing that. Okay, and the person with the audio issue is able to hear us now, so that's perfect. That's great. All right, so if you can, there's a couple more people coming in. So there's a question on your screen about how old your child is, and if you have more than one kiddo at home, you can choose more than one option. And I'm going to go ahead and end that so we can show the results here so you guys can see. All right, and I'm going to go ahead and ask you another question. What are some of your feeding challenges your child has at home? And you can select more than one. You're also welcome to enter any other comments or questions or challenges that you have in the chat box for us as well. So you should see that question pop up for you, and we'll give everybody a chance to respond. See a lot of responses coming in. And I'm sure we'll have a good conversation tonight to help address these challenges. I'll give everybody a little bit more time to respond. I can still see people coming in and joining us. If you've just joined us, there's a question on your screen. If you can respond to that, that'll help us know what challenges you guys are facing. And I will close the poll in just a minute. I see that some people are still responding. And we have a comment here too, you guys, if you can see that chat. Okay, I'm going to end the poll and share those results out so that you can see a lot of challenges here. Okay. All right. And then just one final question for your quiz, and then we'll get started. Has your child received feeding therapy in the past, or are they currently receiving feeding therapy? And you can choose more than one if they used to receive it, and they're currently receiving it, I guess. So go ahead and do that. I see some people responding as well. And I'm going to end this poll in just a second so we can get our presentation started. And I'll share this out. All right, perfect. Okay. Well, thank you again, everybody, for joining us tonight. And I will pass us over to Angela to get started.
Thank you. Oh, are you able to close the poll, Katie? Is it still, it's showing on my end?
Let's see. Yeah, thank you.
Yeah. Thank you guys so much for joining us this evening. We know that feeding and eating challenges at home can be complex and complicated, and we're really, really fortunate today to have all of us here that collaborate on a really consistent basis, those of us in the MeBe family that are occupational therapists or speech and language pathologists. And so we really hope to provide you some really tangible activities to trial at home and give you some background as to the importance of what it is that we do and why it's we utilize such a collaborative approach in our everyday practice when we're addressing this very important daily occupation of feeding and eating. So what we can do to get started, we can do introductions. My name is Angela Ochoa. I am the MeBe Clinical Director of Occupational Therapy. I joined MeBe in November of 2019 and just most recently started this or brought OT to our MeBe family. We'll talk a little bit more about the variety of services that MeBe provides this evening. But some background and history on me. I've been a pediatric OT for going on 12 years. And and predominantly in San Diego. I'm actually born and raised in San Diego, California. Stayed in California for my master's degree, went up north to San Jose State, and then very quickly realized that I need to be closer to family and friends and come back down to San Diego. So I've been an occupational therapist in a variety of different settings in San Diego, outpatient clinics, hospital-based settings, school-based settings. I've done some contracting work for a variety of different places. And I'm really fortunate to have made MeBe my, clinical home, and have such a great opportunity to work so closely with all these different professionals every day. So thank you for joining us. And I'm very excited for you to meet the rest of our team.
I don't know how you beat that, but I'm going to try. My name is Nikki. I am the clinical director of speech language pathology here at MeBe. I started in 2018, so January 2018. And at that time, it was just me as a speech language pathologist. And since then, we have built a team of 10 of us. And everyone on this team is just fantastic in all of our different disciplines. Like Angela said, it is amazing to work with so many different disciplines and see so many different sides of the coin. It's really helped us see kids in lots of different ways. We aim to do the best for each child individually because every child is so different. So your child is going to be so different from every other child we've ever seen. So we have to draw on our experience from all of our different disciplines to make sure we're giving the best treatment. I've been in a variety of private practices. That is my main area of expertise, and we focus on a lot of different things here at MeBe, and we tend to help with kids who have autism. We work with AAC, we work with cerebral palsy, apraxia of speech, and feeding therapy here as well, among a variety of different things. But I'll actually head it over to Highland right now.
Hi, everybody. Thank you so much for being here. My name is Highland. I am also a speech language pathologist with MeBe. If you hear the twang, it's because I'm originally from Alabama. Been in San Diego about 5 years. I usually get those questions, so I just throw it out there at the beginning so everybody knows. But I've been working primarily with kids with autism for many, many years now. I used to do autism diagnostic evaluations at Vanderbilt University, and I was able to work with lots of behavioral therapists, occupational therapists, speech language pathologists there, and that's where I've developed my love for speech therapy. So it's been great working with the population that needs help with their feeding skills. I've really loved it. I've loved working a little bit with the really itty bitties in the NICU, all the way up to currently most of the ages I think we see for feeding are anywhere from 2 to about 8 or 9 years old. So, but we work with all ages, and it's just been really great to help all of our families access these services and help see all these gains in our kiddos, and their families have a little bit of relief that their children are able to expand what they're feeding. So, like Nikki, we work, and Angela and Shayna, we work with so many different diagnoses, and we're just happy to have you all here tonight to talk with us about this really, really important topic.
All right. Hello, I'm Shayna. I'm an occupational therapy assistant here at MeBe. I've been working in OT for 7 years now and loving all of it. I love working with the little guys especially, but it's such a broad field. We get to do a ton of different things, and feeding is such a big area of that because it's happening all day throughout the day. So I'm super happy to be here and getting to share this information. I've kind of like Angela, we have a lot of similar background. I've worked in lots of different settings with adults and with kids, both inpatient, outpatient, done some work with educating other CODA students, things like that. Spent a lot of time, got into the feeding portion of it pretty early on. It's kind of hard to escape in the OT field. Like it's not something that if you work in outpatient, it serves you to learn about it because so many of our kids face it. So everybody that's on here, you're definitely not alone. We appreciate you seeking out that information because one of the things that we share in the webinar is it's so important to address it early on. It makes life easier much longer later down the line. I was a picky eater growing up myself and certainly would have wished that somebody would have helped me out in this way. So we really thank you for joining us for tonight.
All right. So what is MeBe? So I know MeBe is a strange word and we get that all the time. What does MeBe mean? So MeBe is a non-word, but it was something that when we went with this word and we decided that this was going to be the name of the organization and the owners chose it, it's really about being me. So me be me. You have the right to live your best life and to be able to have your own voice. So we are able to integrate research-based strategies with intense personal attention to provide therapy that's engaging, flexible, and customized to your child's needs. But it's just so much more. It's about being able to make sure we are meeting your child's needs in their individualized way. We care so much that we are different in each time we treat a child, because your child is so different from every other child. And that's important because we want to give your child the best therapy. So MeBe is just me being me. Services that we provide ABA therapy, we provide occupational therapy, and we provide speech and language therapy. And within that umbrella, feeding therapy does fall across all of our disciplines. We have a variety of different locations. We're really excited. We've expanded quite a bit, which means we've been able to access services for so many kiddos who have a hard time getting them. We are currently in San Diego, Los Angeles, Bay Area, Seattle, Denver, and Phoenix. And we just recently went into Arizona as well. We do provide telehealth services throughout the state of California, as well as in Seattle and LA, and in Arizona, in Phoenix. But we have 2 locations in San Diego. We have one in Kearney Mesa, and then we also have one in Carlsbad. So we do have in-center services, and at our center down in Kearney Mesa, I'm not sure if anyone's ever been there, but we have a integrated service model. So we have speech language therapy, ABA, and OT under one roof. And we really hope in 2021 that we're able to do the same thing in Carlsbad, and then eventually in all of these locations. So we are constantly trying to be better at what we do and provide the services that your child needs. So don't forget to follow us on Instagram and Facebook. We post a lot on Instagram and Facebook, and we're really trying to give tips for you and your child to use at home. So we tend to do stories, and then we also we just started dabbling into IGTV. So we're trying to figure out our way in that. But we're really trying to stick kind of close to what's happening in the world or with holidays, and trying to give useful tips. If you have questions and you want tips, please send them to us. Respond to us on Instagram. Let us know what you need and what would help you with your child. The more feedback we get from what you guys are looking for, the more we can target these tips towards exactly what you guys are needing. But definitely go through and follow us on Instagram, on Facebook, and definitely check us out online.
All right, so we're going to get right into things, make the best use of time. So obviously the big topic of the evening is feeding. So we want to really make clear what a feeding disorder is. There are differences certainly in being, preferential in choices and then being a picky eater. What kind of things contribute to that? And then some of the different approaches that we have with the disciplines. And then also some helpful tips. That's the big one, is that you leave here tonight having some information under your belt that you can start utilizing as soon as possible. It's obviously, everything we give you is just, a starter pack for sure. It doesn't replace that need for individual therapy. So these are just some beginning ideas, and to get things brewing in your mind, to see what maybe the next steps are, and see where things are for your kiddo. So for a lot of these disorders, we're looking at being diagnosed with a kid who's refusing to eat or drink certain things in a sufficient amount of quantity, and then different kinds of foods that are contributing to weight gain, and then meeting those nutritional needs. So we have anything that a kid needs to be able to really progress as well. And then also the different kinds of ranges are being able to refuse just solids in general. Refusing liquids comes up. We do have some kiddos that have to take nutrients in through tubes. And then that's where that tube dependence piece comes in. The liquid dependence is maybe nothing comes in a solid form, and that's anything that has to really be chewed in any capacity. Different selectivities of food types, food textures, and then not feeding themselves. So these are a lot of the different areas kids can have, range through all of this. We may start out with a child who is completely tube dependent, and then we work through the whole range of it. So it's never, always super simple. Sometimes it's really complex, and then sometimes we can work through it from, a different place. Go ahead. So we wanted to distinguish early on what the difference is between being a picky eater and a problem eater, because that's sometimes a term, like we hear that idea of being a picky eater all the time, but the difference is clear once you put a look at here. So a picky eater is going to be somebody who has a decreased range. They'll consume 30 or more foods, but kind of stick to those. The foods will be lost. They get burned out because they eat them repetitively. So it's a kiddo that like loves grilled cheese all the time. They'll eat it a bunch. Maybe they do tolerate different cheese in there, but they love those particular foods. They'll accept new foods on the plate to like touch it. They might taste it. They're not necessarily showing like huge behaviors when the food's presented, but they're just not super interested in it yet. They have at least one food from each of the groups. That's a big thing. They don't necessarily restrict into an entire category. For example, like they don't only eat starches. They're eating a veggie, a fruit, a protein, a starch, things like that. And then after you introduce a food multiple times, they're much more likely in this picky eater group to incorporate it into their diet. A problem eater is where it gets really challenging because these kiddos are often restricting to less than 20 foods. It's a really small range. If they eat a food and then they decide to stop eating it, it often doesn't come back into their diet. You see these really huge behaviors often come up, sensory and behavioral. So way more feelings involved with these kiddos with introductions. That's more screaming, crying, throwing things off the plate, running away from the table. And then they'll refuse entire food groups. So vegetables will just be completely off limits. We have a lot of kiddos we see that do not eat any form of vegetable at all. And I know somebody mentioned in the beginning, smoothie or otherwise, it doesn't matter how you hide it, it's not happening. And then the thing that makes this really tricky is they may take a food, but it takes multiple times of seeing it over and over and over. So this is a big thing that we'll kind of bring up, is that one time of introducing a food to a baby or to a 9-year-old is not enough. They need lots of chances to learn about foods. So the other one area of this problem eater is that they're inflexible about the format. So that's going to be the presentations of the foods as well. So it'll be, I only eat dino nuggets. If I give me any kind of other chicken nugget, even though yes, it's, chicken with breading, it doesn't matter. I'm very particular on that breaded, crispy outside. Maybe I'll eat a baby carrot, but if you gave me a whole one, then that might be really, really challenging for me to see just because it changed. You put something a little bit wet on the outside. I know it's still my pancake, but I don't know what you did to it. It's broken now. Or even literally my chip, my Pringle is no longer a whole Pringle and it is no longer useful for me. So these kiddos are much more challenging. This is a big red flag for when we're going to try to look for intervention as well. It does not typically improve without support. So these are just some of the, from a lot of the clientele that we work with, these are some of the factors that we see in kids that we bring up. In, a lot of this early intervention services, we see quite a bit of kids on the autism spectrum. And so about 70 of the kids with autism spectrum disorder exhibit some type of selective eating. That's a lot. It's very rare, to be honest, that I get a kid where they're like, I'm not a parent that tells me, I'm not worried about it. But I mean, I could tell you on my 5 fingers, I think that's probably, but most of them, it happens all the time. And it's also estimated that about 65 to 85% of kids with ASD also have sensory processing disorder. And basically what that is going to mean is any type of input that you're getting from the surrounding environment, any of your senses, you're not taking that information in and processing it appropriately. It's going to come through maybe stronger than it should, or not strong enough. And so when we have these kiddos that are picky eaters, typically we have kids that are much more responsive to smell, taste, the visual portions. So they are just constantly on high alert. Their bodies are being bombarded all the time. So we have to be very careful about how we present foods to them. I do want to like make it clear though that there are times within, one of the things is there's typical periods for kids to regress in their feeding. So we do have to filter that through and figure out like what age they're at and is it appropriate, because there are times like my nephew went through an entire year where he mostly ate quesadillas. Leading up to that, he would eat sushi and he would be grabbing salad off my plates and all the things. He made it past that period. So there are things that are, you know, typical to show up. They do show up later on as well, around like 9. Kids get picky again, and then around in their teenage years, they start to regress again. But then they work through those things. So there's a difference between that. Another thing that shows up a lot is GERD. This is going to be that reflux. We have lots of babies that start, and that's a lot of those colicky babies often have GERD. They are super hard to soothe. They don't sleep well. But there's a big correlation between being a picky eater and GERD, and as well as food preferences. So for kids who tend to be more acidy and are having a lot of reflux, they often are looking for liquids to help, you know, keep that acid more neutral in their belly, as well as, you know, we have to think like if our belly's upset, what kind of foods do we prefer? So we see a lot of these kids with GERDs preferring starchy foods and more bland foods. They don't do like spicy flavors. So some of that really contributes a lot, and we have to work from the medical side as well to help support them. A couple other things is like tone is a huge thing. So we do have kids that just with their diagnosis alone, low tone is very common, but it's not, you know, reliant on a diagnosis. Kids with Down syndrome, that's one of the factors for them. They have to work, they're working really hard with all of those pieces. So if you are trying really hard to get your muscles to work, it makes things like breathing harder, holding yourself up, being able to hold utensils, you know, 20 minutes of feeding with my arms, if everything else is hard, it's going to be less appealing. So I'm less engaged in the meal and I might want more support or eat less, as well as having endurance with chewing. So the more dense foods are really hard for me. And then another piece of this is anatomy. We do look at, you know, what does their palate look at when you get into the top of a kid's mouth? Why are they struggling with some of these foods anatomically? Is food getting stuck up there? Do they have the oral motor skills to manage that? The number and the position of their teeth. So, you know, little babies can only chew little bits because they don't have the sufficient anatomy, as well as having low toned cheeks. They're not strong enough to keep the food stuck and working and playing air hockey back and forth with the food, as well as we do face with tongue ties and lip ties as well, which make it really hard to manage food. In addition to, this is why we have the multidisciplinary approach, because speech is able to manage some of those other pieces when intervention's needed, or finding strategies as well. So some of the factors that come up with this for the oral motor skills that we kind of just touched on. First off, feeding is not an innate skill. It's something that's learned. If you gave someone a G-tube from birth, they would never know how to chew. So it's something that you have to actually have the interaction in the mouth and take things in, and then have different complexities of that. So taking in liquid is, you know, a different thing to manage than chewing on a graham cracker, than managing cereal and milk at the same time, and then like chewing up beef jerky. All of those require very different skills. Feeding requires you to coordinate your tongue, cheek, and lip all at the same time. So that's what makes it really hard, in addition to breathing and the other things that we mentioned previously. So that plays a big role. And then swallowing requires the ability to control food in the oral cavity, safely move it back, and then start the swallowing process. So that's a big piece as well, because if you don't do all that thing, that's when we see the gagging and the choking as a defense mechanism. Oral motor skills include like chewing the food, swallowing, having proper lip seal, being able to keep those lips together so that the food isn't falling out, or you're not getting excess air in while you're eating. The cheek movements, so being able to keep them puckered tight enough that the food can stay in the teeth, and the tongue keeping it pushed over. And then what we see, like some red flags for this, symptoms of when kids are having deficits, poor chewing or no chewing. I have lots of kids that you just see them kind of mashing the food back on the roof of the mouth and almost like suckling it back in the way that like if you were sucking on a little applesauce packet. Different types of food selectivity by texture, because they can't manage it a lot of times. A lot of these little kiddos, they may not even be super picky eaters, because this is feeding in general, but they also might not be able to manage really dense foods. So that's another red flag. Even if you give it to them, they're like, oh, chicken's good, but I pushed it out because I can't do this. Inability to advance to age appropriate foods. So they stay on purees much longer than appropriate. Or even those mashable foods. There's kiddos that we have on raviolis at 5, 6, 7, because they don't learn how to chew denser foods. During meals, we see them coughing, gagging, sometimes vomiting, because they, all combinations of maybe the food gets stuck, the texture is really tricky for me, it's gone down and now I'm gagging on it, or the vomiting is like, a lot of times will happen if it's too big, or it didn't mix with my body, or even if it hit and I've gagged and coughed so much that I'm now vomiting. Those are really big red flags. If we have kids that are getting food stuck in their mouth, so like, 2-3 hours later, we look and all of a sudden you're like, where did that come from? That's not a great situation. It means there's a lot of lack of awareness and management of the food. Food's falling out of their mouth. So when they're eating, it's just constantly coming out. And then aversions and hypersensitivities. So that might be to anything, toothbrushing, holding certain things to their face, getting their face washed. A lot of those things contribute as well. And that kind of goes into that oral sensory piece. We have kids that are either hyper, meaning it's over, or hyposensitive, so under, so to texture, taste, and temperature. So if it's texture, like they don't care, it doesn't matter. They'll have a ton in their cheeks. They'll mash it all in there, doesn't matter. Taste, you have both sides. You have the kids that are very sensitive, everything's very bland, or then you have kids who are eating flaming hot Cheetos at 2 years old because they aren't sensitive to it. It doesn't matter how their stomach is registering it, or the backside, but they are still not picking that up. And then temperature too. Like you'll take things out of the oven, kids will pop it in their mouth and you're like, no, it's too hot. That's a concern for us. It's obviously a safety concern. And then the hyposensitivity can also lead to limited awareness of a bolus. That's what happens when you chew up a food, saliva combines and your tongue and your cheek coordinate it. It's supposed to, typically what we see is one thing that's like a red flag on here is if you see a kid who's been chewing a particular chunk of food, they open their mouth and it's scattered all over the place. That's a red flag for us, because it's telling us they aren't properly forming that little bolus we're talking about. Their tongue and their cheek are not doing their job. And then one of the big areas is, with a lot of these kiddos, 61% of children with feeding problems had an oral motor deficit. So that's contributing a lot to what they're managing. So some of the things that we consider for the physical and the environmental factors are how important positioning is. Proper positioning plays a huge role. It's one of the first things that we address in OT. But anybody that's working on feeding, it's a really important piece. Speech addresses this a lot as well, because it contributes to so many portions of respiration, as well as your positioning of your head and neck. So when we do that, if a kid is not having to work so hard to hold themselves up, they're going to have that much more skill with being able to manage their body to feed themselves, as well as swallowing. Everything is aligned properly to work in their favor. So there's a couple pictures on the sides here. You can see there's some examples of a quick fix. They make lots of fancy seating. Honestly, for some of us, it's very frustrating that they make so many kinds of seating that are poorly made, where the kids are horribly positioned. You're like, there's nothing for them to hold on to. They're sitting all the way back and slumped, and their feet are just flopping around. If you feel like you're floating in space, it's going to be challenging to focus on what you're doing. So this is somebody who modified this to position this kiddo in a 90-90-90, meaning their hips are positioned at 90 degrees, then their knees, and then their ankles. So all they did was add a little chair underneath, and they went from, being slid back and not knowing where they are to being able to come upright, nice and tall. So that's one of the first things, if I could say like one thing to take away right away, that would be one of them. And then making sure the environment is supportive. So we look at modifications that you can do to that in terms of the noise, where we are in the house, Is the TV on? Are we using an iPad? All those things, like what's happening around them? Is there somebody next to me playing? Is the dog coming by and trying to eat the food off my plate because what a fun game? You know, what is contributing to how much this kid can pay attention to what they're eating, as well as sensory wise, what the environment's like for them. How long they should be expected to sit. We definitely look at like setting timers for kids as needed, but realistically we shoot for about 15 to 20 minutes for a snack, and then somewhere between 20 to 30 minutes for a meal. Kids who are eating really slowly and taking a long time are much less likely to take in as much volume, actually. So a kid that's sitting for 60 minutes, you're down to a battle now at this point. We're just kind of begging that kid to eat. And so, you know, we work on as well, work with families trying to set up a structured routine and schedule that helps contribute to better intake of food, better appetite management, because all of that contributes to how much food a kid is going to take in. And then last thing is, does the kid have the strength and endurance for everything that we're asking them to do? So, you know, that's obviously a lot. Do they have the core strength, the arm strength, the jaw strength, the strength in their tongue, their cheeks, everything? We look at all of that, and that's where this whole multidisciplinary approach comes in, because each member of the team is going to look at that a little bit differently and find a way to support this kid. So this kind of just speaks to a little bit, I'll just broach a little bit on this, on some of the sensory factors that we look at. And OT is a big thing with our kids who are suffering with like sensory processing disorder. Their bodies are just constantly overwhelmed a lot of times, especially picky eaters. So just looking at distractions in the environment, these are some examples here. And then sensory stimuli, sometimes we don't realize. A lot of our kids are very sensitive to lighting within the room. We have flickery lights in this building sometimes, and all of us are struggling. So we adjust them and get them fixed right away, because it's not fun for anybody. But the kids, a lot of times, are very sensitive. It's distracting during mealtime, and it makes your head hurt. Smells in the room. I remember my mom used to cook with oil. I'd be upstairs and just offended. I like things cooked in oil, but even still, it would like ruin my appetite. But that's any kind of food. It could be anything. Temperatures. So is it too hot? Is it too cold? If you're freezing, you're trying to like maintain strength and warmth, you're not gonna be focused. And how noisy is it? A lot of times it's like, telehealth is a great avenue, but it gives us an insight. Like we're trying to work on something and I hear 3 different things happening. I'm like, the kid is this way, this way, this way. It's really tricky. You know, he's trying to focus on food. And so we start working on like, what are some easy fixes? And these are some places we start. And then lastly is just how food is presented. These are some examples on the bottom of like, different ways we manage it. When we're working on feeding, we have things that are divided so they're not touching, because, God forbid, broccoli get near my watermelon. And then using like the middle is using a very neutral blank slate so that there's nothing distracting. I'm only focusing on my food. And then on the right there, I feel overwhelmed with how that's presented. That's a lot of food, and also a lot of things that like I couldn't tell you most of the things that are on the plate. So I'm going to be much less inclined to try things because texturally I can't differentiate them easily. I don't know what I use a utensil with, what I don't. And then these are some examples on the far right of kids that are kind of dealing with some of those distractions with like animals and, using an iPad to kind of keep their attention and keeping them at the table, as well as a kiddo that's got a TV in the background. If we're trying to engage them in, new foods, we can't compete, to be honest. So that's why this becomes a really important thing. And I think right now we'll let Highland take over.
Okay, so this is a great slide. I'm willing to bet that almost all of you on this webinar right now could list about 20 of these if your child has feeding difficulties. Feel free to share in the chat if there is some sort of aversion that your child demonstrates. We would love to hear it. But what does food aversion look like? It's really obvious, right? Your kids are going to be turning away from the food or the table, pushing the food spoon or your hand away, attempting to leave from the table, crying, gagging, coughing, rapid blinking. They might even look really sleepy if they're going to fall asleep because they're exhausted. So it's very obvious, but I think a lot of times as parents, parents tend to think that it's a behavior, right? It's just, I don't want to do this. I don't want to sit at the table. I don't want to deal with this. And for some of our kids, maybe that is the case. But for a lot of our kids, or all of our kids that have these food, aversions, it's very obvious. And these are key things to look for. Again, if your child, we encourage you to chat with us and send us a chat if you see something or that your child does that's different than what we have listed. We'd love to hear it. But yeah, these are very clear signs that your child is not interested in the food and the way it's being presented. So then how do we get them to the table? They're not interested. They're screaming. They're running away. They're saying no. They're throwing things. It happens to us all the time. We see it every day. Get into a routine and create expectations. So start letting them know. Start priming them, as we tell our families. If they're playing with something, tell them, okay, 5 more minutes, and then it's time to eat. 5 more minutes, and then we get to play with our food and make a fun tower. Use those first, then directions. So from a language perspective, first, then for a lot of things. That's for presentation for another day. But for a lot of things with our kiddos is great because they know that ultimately what they're going to want is down the road, right? So, okay, first we're going to go eat. Then you can come back and watch your iPad. First we're going to have dinner together, and then you can play with your little brother and with trains, whatever it may be. Give choices. Kids love to feel like they're in control. How can we make them feel like they're in control when they're really not? We can give them choices that we want them to ultimately make, right? So which chair to sit in, which plate to use, which food mat to use, which spoon, which cup. Here are your 2 choices. What would you like? They love it. They feel like they're in control. Let's have them walk, jump, and bear crawl to the table rather than, Sally, come on, it's time to sit at the table. Let's make it fun. The whole family can crawl. The whole family can run. Make it very interactive for them so that way they're motivated and they're excited. Or maybe you have them already at the table with a preferred activity. Maybe they're drawing a picture at the table, or they're playing with a toy with their sister, or they're building playing with their dollhouse, whatever it may be. And then you use that priming and those first then directions to help them transition to the food. I love the give an opportunity to get energy out prior to a meal. Have them running around outside if possible, doing something active. That also lets them get out all of that kind of nervous energy and helps them to calm down before they're going to come back to the table. It's really important that we prime them because that's going to help with that sensory piece that Shayna was talking about, to have them ready to zone in and get ready for food. And it also just helps them to understand that mealtime doesn't have to be stressful. How many of you is mealtime the most stressful time of the day? And we don't want that. We don't want that for our kids. So we're going to make this as least stressful as possible by making it as fun as possible, which we'll get to. But the priming piece is a main way that we can start making this a very pleasant part of your day. So helping them stay at the table. Okay, so we've got them there. How do we keep them there? Schedule and routine. So you can even give a picture schedule, right? A lot of times our kids on the spectrum love a picture schedule. Again, it's predictable. It kind of takes out that anxiety of what's coming next or the unknown. So maybe they're going to come and sit down in their chair. You have a picture of their chair. Then you have a picture of them eating. Then you have a picture of them cleaning up. And then you have a picture of them playing with their favorite toy. It can be that simple. You can even draw little social stories for this. You can even draw on a dry erase board or a white piece of paper if you don't have, all these fancy visuals. It doesn't have to be anything fancy. Make it manageable for you and your child and your family. Use that first then language. So first we're going to have dinner, or even step by step. First we get our fork, then we sit down. Whatever your routine is. Use a digital timer. So a lot of our kids love timers. Again, it's predictable. They know when something's going to end. They know how much time they have on the clock. It just helps them feel comfortable. It helps them feel supported. Definitely decrease the wait time. So don't call them over to the table and make them sit there for 5 minutes. Kids, they're going to leave, and then you're going to have a hard time wrangling them back. So really make sure maybe that the food is already on the table, or make sure you're getting ready to present it to them when you call them over. Have the food ready. That's crucial. So if we're going to get them all built up and make this transition fun, it better be really fun when they get there, and the food better be there for them. So like Shayna has mentioned, we do a multidisciplinary approach at MeBe, which is really, really cool. It really makes us different and unique in that we get to collaborate every single day on kids. We get to look at each other's kids and give tips that we would do based on our discipline and our unique education and knowledge. So the speech side of things, we formally assess the oral motor skills. We address safe eating and food progression, so meaning swallowing, essentially getting the food in the mouth, how you use your tongue, how you use your cheeks, how you chew, and how you swallow. And then we utilize our unique perspectives to collaborate with OT on more of that sensory piece, right? So they're going to really focus on that oral sensations, any of the sensory processing, feeding versus eating, and it really merges beautifully in how we're able to collaborate with both approaches and use our unique training to make the best plan that's unique for your child. So what does an assessment look like? Well, first and foremost, you always want to get an approval or a referral from your pediatrician. Number one, we have so many families who contact us about feeding, and the first thing I always say to them is, have you talked to your pediatrician about your concerns? Have they cleared your child for feeding therapy and for an evaluation? So you just want to make sure you have that medical clearance, that it's safe, because there are going to be some kiddos that are more medically fragile that feeding therapy is going to be better for them in a hospital setting, because we just don't have the right now the options to be able to treat a lot of those kiddos because they need that nurse or that doctor very, very close by. So make sure that you get clearance from your pediatrician. Then we're going to do a very thorough interview with caregivers about meal times, your food repertoire, medical history, diagnoses, what's going on, what are those food aversions, what does it look like when you try to present a new food. And then we're going to observe an actual snack or meal time. And we often like to observe a preferred food that your child likes, so we can look at that chewing and those oral motor skills and that swallowing. And then we're also going to look at your presentation of foods that are non-preferred to see how the child reacts, what they do with those non-preferred foods. Also, we're kind of seeing what the environment is, how you typically as a parent present things. Not that we are judging your parental skills at all. It's more so just what can we do to help you make that environment a little bit more pleasant, or what tips can we give you to help you with that presentation. We're always going to do an oral motor assessment. We're going to look at all of those oral motor skills, and that means everything from lip closure, lip strength, tongue elevation, so that's up and down, how your child moves their tongue from side to side, how they move their tongues with food, the strength, the jaw strength and range of motion, how are they moving their mouth, how are they chewing, the cheeks, you name it. We're going to look at the structures. We're going to look at the range of motion, so how they move their articulators or their oral, their I guess you could say articulators, and how they are, what the strength is like. I'm used to saying articulators because that's what I say every day, okay? They are your articulators, okay? But anyways, we're going to do a preference assessment as well, right? We're going to try to figure out, all right, so they are only eating chicken nuggets and they are only eating French fries. That's what we're working with. And this is going to give us so much information about how to develop a therapy plan for your child. So the oral motor assessment is basically what I just kind of mapped out, right? We're going to look at the anatomy and the structures. We're going to look at the palate. We're going to look at the tongue ties, lip and tongue, cheek strength or tightness, teeth alignment, missing teeth, the jaw alignment, tonsils, adenoids, the management of the various textures if your child's able to do so, so liquids, purees, which purees are really like baby food, basically, applesauce, that's what we're thinking of when we think of that. Soft textures, hard textures, so soft textures kind of like fruits, really soft fruits, maybe some breads, things like that. Hard textures are going to be your more crunchy foods or your foods. I would even consider like meats as more of a harder to manage-ish texture, especially for a lot of our kiddos. And then the combined textures. So a lot of our kids have issues with the combined textures because they're combined and they don't like anything to mix with each other. We're going to look at the chewing patterns. So are they just chewing up and down like this? Are they chewing kind of, they got some jaw sliding? Or do they just roll onto one side? Or do they have a rotary chew? Most people don't realize this, but we don't chew up and down. We actually have movements in our jaws from side to side that help grind up the foods. And you have to have a rotary chew to chew up a lot of foods. And then we look at the coordination of all of these movements. It takes a lot of coordination, a lot of strength, and a lot of range of motion. We also will make the appropriate referrals immediately to dentists, orthodontists, ENTs, dietitians, GI specialists after our evaluation. So the road to healthier foods. This is a great example. I love this visual. Granted, we understand that not every child is going to follow this exact road to healthier foods, but this is a great example of how we would work to get them there. So you would start with something that the child loves, which most kids do, and most of our kiddos, they love the goldfish, but they're not into carrots, right? How are we going to get them there? We're going to think about what are some foods that are similar in texture and similar in color, so it's not as scary, right, to get them ultimately to this carrot. So you'll see here we go from the goldfish crackers to the cheese puffs, another favorite that a lot of kids, once they get a few bites, they really like them. Then we go from cheese puffs to the carrot chips. Then we go from the carrot chips potentially to the actual hard carrots, and then we can go to sweet potato fries. So as you see, that's how we're able to expand using what a child already eats. So a lot of families will come to us and say, my child only eats chicken nuggets, goldfish, and french fries. How am I going to expand on it? This is just an example, a visual of how we can help do that. And I love it. It's so great.
Okay, so to sort of piggyback exactly on what Highland was mentioning too, is that really we're determined in our feeding sessions to really find those bridges to the foods that your child is currently eating, to the foods that is a goal for them to eat eventually. And in OT and in speech and language therapy, what we attempt to do is when we're working in with kids and exploring different foods, we really have to make a clear distinction between our mealtime foods and our therapy meal, essentially. So during mealtime, a lot of these strategies may not come into play. What we attempt to do is also establish a routine for our therapy meals. Our therapy meals are ways in which that we can explore different foods, explore different textures and smells and sights and everything that's important to the different foods that might be the deterrent for the child. But the expectation in a lot of these therapy meals is not to consume the foods. The reason because of that is because perhaps some of the foods that are presented during these therapy meals are foods that your child won't even tolerate in front of them. You might put food on their plate and automatically they're pushing the food away, they're throwing the food on the floor, they're gagging. So the expectation, that's a pretty sizable leap to go from I don't want the food to I'm gonna eat the food. We know that's an ultimate goal, and it's really important for us because all of us are on that page with you, and we really want to help you get your child to be as successful as possible with the different foods. But in order for kids to start somewhere with at least tolerating being around the foods, we need to learn how to play with them. And that's why we distinguish therapy meals versus mealtime. Mealtime is when your kids get the volume of food intake, they get the nutrition that they need, and the foods that they should be eating as best they can, or certainly the foods that they can currently tolerate. Therapy meals is more presented in a similar fashion in which that they might have experienced during mealtime, but the expectation is exploration. We're going to learn about the different characteristics of food. A lot of times we get in the habits of saying, this food is really good. And the kid goes, no, it is not. And they're going to tell you the no, it is not in a lot of different ways that Highland described certainly previously. And we know that, and that's true, because to them, it's not good. So good to us might not be good to them. And so it's really important for us to also use these therapy meals as opportunities for us to learn the different characteristics of foods that kids have in front of them, and learn new ways to describe foods that aren't necessarily good versus bad. So for instance, we've got this little one learning to play with carrots. They're learning to play with the shaved carrots. And so what we learn about carrots is carrots are orange. We can see that the color is orange. We learn that carrots can be wet. Once you peel a carrot, the inside of the carrot has some water to that. Carrots can be cold. If you keep them in the fridge, they're cold. Do you feel that? I feel that with my hands. Carrots can be really crunchy. If we have the full carrot, the baby carrots or the longer carrots, they can be crunchy. Listen to the sound when I crunch the carrot. So we try to encourage as much opportunity for kids to explore and learn about these foods as possible. And we realize that a lot of this playing with food isn't always appropriate for mealtime either. So we recognize the importance and the value and giving kids a safe space to explore some of these foods. So a lot of times in speech and OT, we get a little messy. We want to also support the kids who can't tolerate getting messy, but we want to encourage it in a way that is appropriate for you and your child too. And that's certainly appropriate for you and your family and your household. So other ways that we can explore foods, maybe we can explore the pasta with our fingers. Let's pick it up, see how long that spaghetti is, and then drop it. Ooh, I heard the sound of the spaghetti. Splat. There's sauce on the spaghetti. Oh, it's on my hands. What do? I need to wipe my hands. Or, things like that, giving kids opportunities and some ownership over what it is that we're doing and why we want them to do these things. It would be wonderful if kids go from, I don't want food, to I'm going to eat food. But what some of this engagement does, instead of them jumping straight to there, they might get some pasta sauce on their fingers, and then they might feel more inclined to taste it. Bring their finger to their mouth and taste the pasta sauce, or bring a noodle to their mouth one by one after I've gotten a little bit more acclimated to the food that you're presenting. Some other ways to get kids engaged with food is to use maybe some familiar toys. So I'm not going to touch the food. I'm not going to eat the food, Miss Angela. I don't want any of this stuff. But what if the tractor pushes all of the pasta to the left side of the plate? So now what we're getting is we're getting the child to engage with the food, which they weren't doing before, learn about the foods because they can see, smell, feel the different textures and the different things. They can smell the flavor of the food in a lot of instances. And then now they're more inclined to engage with the foods, because what we do in these therapy meals is we try to eliminate the pressure of you need to eat the foods. Most of our kids know what their job is when you present food to them. They know it's supposed to be eaten, which is why almost immediately they're going to push it away and say no if it's a food that they're not familiar with or a food that's presented in a way that they don't like. So what we try and do is increase engagement as best we can. And this is our first step into doing that, is by allowing them, eliminating the pressure. Sometimes even kids, I say, we're not going to eat foods today. We're going to explore foods. We're going to learn about foods. Oh, what foods are we learning about today? Instead of what foods are we eating today? They know what we want them to do. And so our goal is to start incorporating engagement as best as possible. And there's a couple different suggestions and strategies on this particular slide.
And so the next thing that we do work on a lot with our kiddos, because the oral motor activities are so important, because the oral motor movements are determining kind of some of those textures that your child can eat. So your child might not eat a carrot, maybe not because they don't like the color. It's not even about the color or the taste. They can't physically chew it. They don't have enough strength to chew it off and take a bite off their molars. Some of our kids bite in the front, and you see the kids and they just bite everything right here. A lot of our kids take things and they pocket it. So you'll find food later on in the day still in their mouth because they just never cleared it. You have to be able to actually use your tongue to clear out the sides of your cheeks. So you might get things stuck in your teeth. They just don't have the ability to get them out. So they just hang out there. Or you see a lot of our kids who do this, and they're moving the food actually with their mouth into the right position. So some of our kids put their hands all the way in their mouth to try to get the food in the right place. Or you have kids who overstuff. And what they're doing is they're moving food to move the other food back. So you have a lot of kids who, they look like they're eating, but what they're doing is they're putting in a blueberry and they're going, not one chew. And I've seen this a lot. And then families are like, well, you see this a lot with corn, often with babies, right? Babies eat corn and the corn comes out completely whole. Well, this happens to some of our kids who are older and some of our adults who cannot chew. So I know one of the questions was about how do you help with chewing? And so there's a variety of different ways that you can help with chewing. Some of these activities here are even just working on lateralization of the tongue. So you can see up here with the lollipop, what they're working on is getting your tongue from one side to the other side. Why is that even important? Because when we eat, we're moving with our tongue and we're able to clear on different sides. If you get food on your lip, are you able to get it? Or are you groping? If you're groping to get food, when you open your mouth, the rest of the food goes out. So a lot of our kids look like messy eaters and we don't give them that food, or you're constantly taking a spoon and we're fixing it. Right? So what a pleasurable experience you feel when all of a sudden it's like scrape, 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 bite, scrape, scrape, scrape. So then our kids don't want it. And you're like, you used to love yogurt. Well, I don't love yogurt when someone's touching my face every single time I take a bite of yogurt. Get that yogurt away from me. So these are the things to be mindful. That's why that sensory play is so important, being able to be messy, because no one enjoys those things happening to your face when you are trying to work on them. We do use a variety of approaches such as Beckman, the Beckman Oral Motor Program, and that can help us to target the musculature around the cheeks and the mouth. It takes so much to be able to chew. So like Hyland said, we are chewing in a rotary movement, but not even just that, you have to coordinate your mouth, your tongue, you have to get the food in the right place, you have to take the food, you have to be able to know when you're too tired on this side of your mouth, I need to lateralize the food, which means I need to move the food from this side of my molars to the middle of my tongue over to the other side, and I need to do that safely so it doesn't go to the back of my throat and I choke on it. If you find that your kid is coughing a lot during eating, if they cough after they drink, if later on all of a sudden they're choking, like maybe that food is getting stuck somewhere, or they weren't able to chew it in the right way, or they chewed and a little piece got stuck back there. And so chewing is so complicated. It is really tricky. So these are just some of the ways that we do work on it. One of my favorite activities working on tongue movement is you have to make sure your child is safe in this. So it is really important to always speak with your pediatrician, make sure there is no aspiration happening. Aspiration is when food goes down into our lungs. That can cause pneumonia. So if your child is getting sick frequently, if they have colds frequently, if they're snoring a lot, those are all signs. Like, go to your pediatrician and make sure nothing else is happening. But one of my favorite activities is taking a Cheerio and taking the Cheerio and putting it on the tongue. And then you move the Cheerio with your tongue to your back molar. And then you can work on the other side. It's really fun to do with your child. So again, with feeding therapy, you're doing these things with your child. It's not, okay, take this Cheerio, now put it from your tongue and move it to the other side. That is actually why we have seen that telehealth has worked so fantastic during this time period. During COVID, in the center, we are wearing masks. We cannot eat with the kids right now. It is really hard to show someone what to do with your mouth when you can't see your mouth. So we're learning different ways. We're opening our mouth. We're showing them with our tongues and different ways. But telehealth is fantastic because you can see my mouth very clearly. I am right there in front of you right now. So these are the things you want to think about when you're playing with the food, or when you are working with the food, you're doing the same things as your child. That makes it really powerful. Imitation is the greatest thing to help your child start to learn. So then we can also learn on or work on blowing bubbles. Blowing bubbles really helps you to kind of build that strength and that ability to move your lips and make your lips round. To drink from a cup, you don't think how important it is to have all of that lip strength and to be able to cup your lips and move your lips around it, and to go from a big cup to a little cup. So that is something that I know both Angela and Shayna work on a ton with OT, is finding the right cup to help you sip from. Sometimes we use little teddy bear squeezes to help with the pressure, because it's really hard to suck up with a straw and suck up this materials. And then if you think about water is really tricky. Water moves all over. It might go into my mouth, and water is really tricky because it's so thin that it can move backwards really quickly. So some of our kids, when they first start drinking, they start coughing right away because that water, right back to the lungs. And so Angela actually has a really cool tip in this one. So I'm going to let her share that because she's fantastic. So Angela, want to pop in?
Sure. So much shared love in this group. I appreciate it, team. The only addition I've made to this fantastic slide that Nikki's put together is working on some oral motor skills specifically to the movement of our lips. Nikki just mentioned how important our lips closing around a straw or closing onto a cup, or when you're eating from a fork, your lips help clear the fork and not just relying on your teeth. And so a lot of our children a lot of our clients that we see have difficulty with the coordination of their lips. And so one activity I like to play with our kiddos that can safely eat this particular food is use things like a licorice rope or something that's a little bit longer. And so our challenge during our therapy meal is to see if we can be able to eat the licorice rope only using our lips. And so what we have to do is bite the licorice and then advance the licorice with our lips. So we're working on the really small muscles of the cheeks. We're stabilizing the jaw, and then we're also working really much on the lip closure and coordination. And a lot of kids want to use their hands, but it's a really fun competition, especially for our older kiddos that might have some weakness in their oral musculature. And so I like to play this particular game as a competition. See who can do it very quickly, or the fastest, or do the biggest pull into their mouth from the licorice. Certainly this is also, we've said this a lot, but I'll mention again, it's important to make sure that your child is safe to eat this particular food, as licorice ropes are a little bit more challenging to eat, and certainly encouraging quick eating also needs to be made sure that that's been deemed safe by your therapist. But that's one game that I added, so thank you.
Yeah. And something to add really quickly too is if your child does have difficulties with this chewing, you do want to seek out help. It does not matter how old they are. We can help them and help you. So often telehealth is to watch to make sure that we can help you within the home setting too. Sometimes what we will do too is you can do frozen French toast. So it's something that is soft, it's easy to eat, but if it's frozen, you have a little bit more ability to keep it in your mouth to chew. You just want to be very, very careful what you work on to chew, because if they cannot handle it, that is when a choking hazard happens. So it is always important to seek outside help, but there are things and textures that you can play around with that are safe. And then the lip ties and tongue ties, they do affect feeding therapy, not just speech therapy, but they affect the feeding. So often when we get a tongue tie or a lip tie, we're like, oh, I wonder how they're eating. And we often see that first because a lot of our babies, when they're itty bitty babies, they have a lot of reflux. They cannot take the milk down. There's a lot of air that goes back with it too. And with those oral ties, there's often anterior and there's also posterior. So you might not even see the tongue tie, but you see this little indent and it looks like a heart. And depending on pediatricians that you go to, some people are a lot more likely to remediate it, and some people are a lot more hesitant. So it really just depends on who you go to. If you find that in your gut, you're like, ooh, there is something here, it doesn't mean that you don't have to stay with that pediatrician. You might need to seek elsewhere. There are a lot of pediatricians in San Diego who are hesitant, and there are a lot who are fantastic. Now, that doesn't mean if you have a tongue tie, go get it cut. It is function. So you're looking at the function and you're looking to see what your child does, or your young adult. A lot of us have them and we just make it do. And we've learned how to compensate. You just don't eat the chewing, or you don't eat the chewing. You don't chew different foods and you avoid different foods. A lot of dentition can cause difficulty with chewing. My brother, who is 30 years old, has a severe underbite. He chews steak differently and he gets heartburn from it. And I know exactly what's happening. He's not going to get his dentition fixed at this point because that takes him out for so long and he can't afford to do that. But he has to compensate by having smaller bites and putting them back, and his jaw gets tired more quickly. That doesn't mean he can't eat foods, but knowing what happens can help you see why this is happening with your young adult or with your child.
Absolutely. To add a little bit more too about how we might present foods to kids, Highland mentioned earlier too, we want to make the experience as fun as possible when possible. And so it's important to recognize the way in which we present foods can oftentimes encourage more engagement, interaction, and ultimately consuming foods. So a lot of the the things you see here have some good opportunities. Maybe your child is eating very one color foods. And we also mentioned too, it's a lot of times it's chicken nuggets, French fries, toast, cereal, chips. Those are all one color. So what a fantastic opportunity to learn about the different colors that foods come in with pizza. A lot of our kids eat pizza, but they only eat cheese pizza, or they only eat pizza that's plain, maybe a little bit of sauce. So what's really nice is perhaps maybe as a family, we're going to make a rainbow pizza. And look at all the different colors and variables that can be added that exist in the world. So what another great opportunity that can happen for kiddos in having food presented this way is maybe you can also incorporate a lot of what you're working on in the meal preparation. A lot of what we do, engaging with foods, slicing fruit, spreading a spread, pouring dry pasta into the pot, stirring soup when it's being made, whatever it is that you're doing, if there's an opportunity there for your child to support you and assist, what a great way to learn about foods also. I think a lot of times what happens for our kiddos too is they don't know what is in their food once it's on their plate. And so having them participate in the mealtime process or having them create some of these fun sculptures gives them opportunities to understand, I didn't realize that, carrots sliced and cooked with flour and made into a dough and then baked is bread. You can make bread with that. Whoa, I think a lot of times kids just see the food in front of them and that's it for them. They've decided they don't want it. But perhaps getting them involved in the process may support that. We can get really creative here. I've been known to create some fun faces with food where maybe the child will eat toast and hummus, but they will not touch olives or popcorn, or I think this isn't popcorn. This looks like maybe like scrambled eggs, olives and things like that. So we're going to decorate. That's our job today, is we're going to decorate. We might still only eat the bread and hummus, but isn't this great that we were able to learn about these other foods? And then guess what? The cucumber that's sitting on top of the hummus, that touched a little bit of hummus. I wonder what it tastes like if we were to just lick the hummus off. Oh, I wonder, interesting. Cucumbers are crunchy. What if I bite that with a little bit of hummus on? So there's some really great natural opportunities for food exploration in some of these fun activities. We can make pepper eyes. That's bringing food to your face. Even if it's up here, it's pretty close to your mouth versus out here. So maybe we're going to make some pepper glasses. Maybe we're going to try a couple different types of ants on a log. I know this is a pretty antiquated snack, but what it does, celery tends to be not the most favorite of snacks for a lot of our kids. But what it does is it creates opportunities for kids to learn about foods, even if what they're eating is really just the peanut butter or the cream cheese or the hummus or the avocado that's inside. Now, the celery, they're also getting some of that flavor. If they just lick off the peanut butter, they're still tasting some of that celery. So it takes, again, some of that pressure off, presents foods in an interesting and novel way, and hopefully will encourage more engagement.
And with engagement, what a great way to lead off. We are going to explore all of these foods and engage with them in lots of different ways. So with telehealth, it's been pretty cool because I do quite a lot of drawings. I am a terrible artist, but the kids just really, really love it. My nice little Cheez-It squares make Cheez-It trains, and they make their Cheez-It trains on the other side, and we chew, chew, chew right along the way. And it's really fun because you can have one of the kids I'm working with right now too, he has little Teddy Grahams, and we always kiss the Teddy Grahams goodbye before they get onto the train. So we are actually interacting with our lips with the teddy bears because he's kissing them goodbye. But when we first started, he didn't even want to look in the bowl. We were not even wanting, no, I can't do it, can't do it, can't do it. And that's something that we hear a lot. I have one kiddo that Highland and I share, and he's just the funniest kid. I just love him to death. And he goes, nope, can't do it. That's yucky. I know that's yucky. And then we say, we're still learning. We're still learning. He goes, yeah, you're learning it's yucky. And we just keep telling him, like, I know blueberries are different. Blueberries sometimes are sour. Blueberries sometimes are sweet. Blueberries are blue on the outside, and sometimes they're a little bit scratchy on your tongue. And sometimes when you put them in your mouth, they pop, and you feel that liquid go in different places. So think about how hard it is to eat a blueberry. It feels like a ball. It can be really, sometimes when they're getting a little bit towards their expiration date, they start to get wrinkly. They can be mushy on the inside. They can be really sour. They can be really sweet. This is why our kids stick with Cheez-Its. Cheez-Its and Goldfish, they taste the same every single time you eat them. Nothing ever changes. An apple tastes different. You can get a green apple versus a red apple. Sometimes that red apple is really good. Sometimes it's brown in the middle and it doesn't taste good. We know that it's just that particular piece of fruit, but our kids feel one bad experience can feel like every single time they eat that blueberry, it's going to be bad. So why would I try that? So what we do is we start to help them explore foods. So we start our sessions a lot with, what are we learning about today? So some of our kids start to say, today I'm learning, and they start telling you exactly what they're learning as soon as you pop on the Zoom screen. And it's probably one of my favorite things ever. They tell you everything that's on their plate. And then we start to work on moving up the hierarchy. So you start with just visually having it on your plate. Can you visually tolerate it there? If not, that's where we're starting. If you can't have it on your plate, can you have it in the room? Can it be next to your plate? Or can it not even be in this room? If it's not even in this room, like that's that's difficult, right? You're just slowly trying to get the food a little bit closer to the child. Can they touch it? Do they poke it with their finger? Will they poke that apple, poke, poke, poke? Will they pick it up and play the drums? Boom, 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 boom. That's an important thing to do, right? It's fun, it's movement. They might even not realize they're working with food at that point. I'm working with one family right now, and I just showed them that's an apple. I was like, just take the apple and play the drums. He loves the drums. Boom, boom, boom. Little kiddo picks it up. Boom, 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 boom. He played with it for 25 minutes, and then at the very end, kind of like, that's interesting. Touched it to his tongue, was like, nope, and then kept playing the drums, but that's okay. Right? That was one exposure where he touched it to his tongue and he explored. The first thing often parents want to do after he touches it to his tongue is like, just take a bite. We don't want to do that. Take the touch of the tongue to the win. That's a win. That's a huge win in therapy, right? We brought out apples for the first time. He touched them. That's a win. He looked at them and he played with them. That's a win. He started to put it up towards his mouth. That's a win. Can he get it to his lips? With a kiss, that's a win. And so we're slowly moving up and we're making it really, really fun. Sometimes I will show videos to my kiddos to show them what other animals look like eating the food too. And we talk about blueberries, and blueberries are wet and they're a little bit mushy. And what does it look like on the inside? Show me what your blueberry looks like. And they show their blueberry and they talk about what their blueberry looks like. And so it's just a fun way to explore and become less sensitive overall to what's on your plate and that worry piece. We want to make sure they're not worried. So we're not going straight from the plate to their mouth. If they pick up something that's new, fantastic. Let them eat it. They can eat it. It's fine. If they don't do it, then you don't want to expect that as well. So it is okay. A lot of times our families don't want to waste food. We understand that that can be a concern. So we always sometimes say, just take something that's on your plate for dinner and save it for later, right? Like not all the time does everything get eaten every single time that you have leftovers. So you can save little tiny pieces and use them later on, but it is important that they get exposure and they learn how to play. You can roll an orange, you can scratch an orange, you can throw an orange up like a ball, you can put an orange as a hat. So there's lots of ways that you can play with that orange before you cut into that orange. And a fun way to do it also is have them having part in the activity too. So maybe they can cut the orange and you can help them safely do it. Or maybe you have fun little kid ones that they can practice with you. Maybe you poke the orange with the fork and you pick it up and then you pull out that fork and you smell it. So you're interacting with the orange and everything in all new ways. So we are going to go based on what your child's skill level is with each individual food. It'll all be different based on the color, the texture, the smell, the feelings of it, right? Is it sticky? Is it smooth? Is it something that they can pick up and it doesn't really feel like anything and it just feels like a ball? We're going to go based on what your child does with each food.
Yeah, I think those are fantastic examples too, Nikki. And I think it's also just important to note too that a lot of this progression of this kind of hierarchy that Nikki mentioned with the touching, smelling, tasting, licking, and then ultimately biting and chewing the foods is based in development. This is how we all learn about foods. And so it is important that for some kids, they can go straight from touching to chewing. For some foods, they can go to touch, to smell, to touch, to, oh, I don't even want to touch it. So it's important for us to also honor the importance of development when it comes to this. We recognize wholeheartedly that this can feel painstaking because we know how important feeding and eating is to everyday life. It is one of the most important, I would argue, occupations that we engage in, and we have to do it every day. We have to eat. We have to feed ourselves, or be fed, or whatever that looks like. And so it's really important that we honor the independence that comes with a lot of these different steps, and recognize that these are the steps that maybe your child is missing by not avoiding foods altogether. And so this is why we really do determine what's the meal, what's the mealtime at home, and then what is the treatment meal, because the treatment meal is really taking each of our kids through this, because the focus isn't on volume or intake. The focus is on exploration and really working through these developmental steps. As we lay a solid foundation, then you're going to see that your child's going to require a much less prompting when it comes to, now we're going to touch it, now we're going to smell it. They're going to do that automatically. Like Shayna mentioned at the beginning, feeding and mealtime is learned. And so these are sometimes, even with our much older kiddos, they've never fully learned what it means to eat. And so this is how we can teach them. And so absolutely, sometimes it looks like we're just messing around, but in actuality, there's a lot of really important learning and successes that come in exactly what Nikki mentioned. We know this is a timely presentation for a lot of different reasons. Thanksgiving is right around the corner. So we wanted to make sure that we really touched on this as best we can, and recognizing the challenges and the successes that can come with things like Thanksgiving. So first and foremost, understanding that Thanksgiving is a very special time. We know that during a pandemic, it can look a little bit different than maybe years past, but if you are celebrating Thanksgiving, Thanksgiving is a very special time for a lot of different reasons. There's a lot of rituals and routines and things that are truly valuable that are individual to your family and your friends and whatever the Thanksgiving looks like. And so maybe recognizing why Thanksgiving is kind of a topic that we wanted to make sure we included here is, first and foremost, what is your goal for the day? We know that Thanksgiving is very anxiety producing for parents and kids, because especially for parents of kids that are problem feeders or problem eaters. Feeding is hard 364 days, and now we've added this big event where the only thing that we're supposed to do is eat. And that's really stressful. And I don't mean to laugh in terms of levity, but it's just the truth of the matter is it's a very stressful event for a lot of families. So what we always try to encourage our parents is to really establish, what is your goal for the day? If you are going to have a lot of family members over in the space, and ultimately your goal is just to get through it, and just let's see if we can avoid any meltdowns at the table or gagging or vomiting that might occur because we put food on, Johnny's plate that he couldn't tolerate. Just get through the day. And, certainly if you are in feeding therapy, or if you have access to any of your therapists that are currently working on this, talk to them about what this could be an option for you of how to get through the day. What's really wonderful about Thanksgiving is it gives kids an opportunity to discuss the different flavors and the sights and the smells. So sometimes, as Nikki mentioned, that's a win itself. They're in the room as the same flavors of things they've never maybe seen before. Like, this table is filled with soft textures, mixed textures, pureed textures, liquid textures. There's so many things here that we can give kids an opportunity just to discuss. If that's the only thing we can get through for today, and Johnny's still going to eat maybe the bread rolls or maybe the mashed potatoes, maybe if we're lucky, that's as best as we can do, that's okay. Because we had so many other great opportunities for us to discuss the sights, the smells, the flavors, the textures, the novelties that are there. Maybe you're the one hosting Thanksgiving, and this would be a really great opportunity to get your son or daughter in the kitchen. We're going to mix it up. They're not going to eat it. We've decided they're not eating it, but maybe they can help support it. And maybe by them making the foods, they will be willing to taste it. They will be willing to touch it to their lips. They will be willing to take a bite. So giving them opportunities, recognizing, again, as Ms. Shayna said at the beginning, sometimes we need to remember that at Thanksgiving, there's so many different textures, and plates can feel overwhelming if there's a lot there. So the importance of foods, if your child is a kiddo who can't have foods touch, support them in that way as best you can. There's lots of different things out there that are available. Certainly section plates is one way to do that. Another barrier to some of the challenges that we could experience during Thanksgiving is the sites. There are so many new people in our environment, or people that are not normally in our environment, perhaps, that are there. It's a busy dining room table. There's a lot of people. Kids are sitting, kids are talking, kids are loud. Maybe there's music, maybe there's candles lit. There's lots of things on the table. That could be a truly overwhelming environment for your child. So having them perhaps take breaks, giving them a safe, quieter space when possible, when necessary, and recognizing that maybe during mealtime, they're not going to eat. They might eat before, they might eat after meals, because recognizing that it could just be very challenging for them to really sit in that space. And not enough is challenge alone. If our goal is just to get through it, let's just get through it. And these are some strategies we can work on. Another thing it's important to make sure that we're recognizing and adhering to is preparing as best we can, depending upon where your child's at with their, cognition and their ability to learn. Prepare your child for the day. Let's talk about what we're going to see. Who's going to be there? What are we making? Where are we going to sit? What do you expect to see at Thanksgiving? I ask this question a lot to kids. What do you expect that Thanksgiving dinner is going to be? And I've had kids be like, hamburgers. I'm like, well, is that what mom is cooking, or is that what dad is preparing, or is that what people are bringing over? Okay, it's not hamburgers. What else is Thanksgiving? Giving them opportunities to talk through what might be available in front of them can help prepare them and lessen maybe the anxiety or the concern that leads up to Thanksgiving. Can be really supportive. Another thing too is if maybe mealtime is too stressful for your child. Do you have other Thanksgiving traditions that you might want to impart with them? Maybe there's a song to sing. Maybe there's a blessing that your family adheres to. Maybe there's setting of the table. We're going to use the really special Thanksgiving plates this year, and you get to be the one that does that. Did you know that forks and knives go on the table at the same time for some people that are adults? This is where glasses go. There's a lot of tradition that can be included in Thanksgiving that aren't necessarily just meals. And certainly if you have questions about that, ask your therapist if you're currently seeing someone for feeding therapy, or reach out to us and we're happy to help. Lastly, recognizing too here the risks for delaying intervention. We've talked a lot about how we know that feeding eating is a necessary and vital occupation that we all participate in daily. Here are some of the risks for delaying intervention. If you think maybe my kid's a picky eater, they're fine. I was picky when I was growing up, blah, blah, blah. Here are some medical implications to look out for and some things that might happen. A lot of times, as Hyland mentioned, more often than not, we get parents just learning that, oh, OT, speech, they work on feeding. Let me go reach out to them. So sometimes in us, getting the proper referrals and meeting with them, we recognize all of these other risk factors that your child may have coming to you. So we might learn that your child is having difficulty gaining weight, or weight loss might be a challenge for them in a consistent fashion. So that's delaying milestones and development. A need for G tube placement or other kind of alternative not by mouth feeding options for children. For kids that have severely limited oral intake of food, this might be the only option for them, especially if we delay it. So it becomes really important for us to do this as early as possible. Nikki mentioned aspirative pneumonia. If there's some swallowing difficulties, if your child is sick often, has some respiratory issues, asthma, lung issues, whatever you might have as a recurring factor, could be an indication that food is not going where it's supposed to. We have a lot of things that are supposed to go in different places. Your air goes down your trachea into your lungs, and food is supposed to go down to your esophagus, to your stomach. And when those paths cross, it can be truly damaging. We talked a little bit more about that earlier today too. There may be some underlying medical conditions. Shana mentioned earlier that a lot of our kiddos as babies might have GERD, and then they grow out of it. And so we're fine. We don't have GERD anymore because either it's been, we've grown out of it, or we've had some medical intervention and now we're fine. But what happens is that early stages of GERD create these challenges and loopholes in development that maybe your child missed, or Perhaps there's still GERD going on, but now it's easier managed. It's not as obvious. Where GERD in babies is likely spitting up and vomiting, GERD in adults is maybe just feeling uncomfortable, or not adults, with children, and adults too. Other things like eosinophilic esophagitis is another thing that a lot of times, that EOE, it's the hardening of the esophagus that makes truly feeding and eating much more challenging, and a lot of times goes very untreated because they don't know that's what's going on. So your first step could be your therapist, and then we can help support you in recognizing what some of these other risks could be, such as GERD and some of these other things mentioned. We also know social and developmental challenges come from feeding and eating challenges. Obviously, number one is nutrient deficiencies. So if your child is only eating those starchier foods, we're really missing out on a lot of important vitamins and nutrients and things that our bodies need in order for us to do our daily life. We see a lot of kids with sleep disturbances. We see a lot of kids that have a hard time with endurance. This could very well be mostly related to their diet, and oftentimes it is. So we work with you, and certainly other professionals like dietitians, nutritionists, GI docs, things like that, to help support you. Where can we find ways to get nutrients when they're not in part of your everyday diet? And it's important to recognize this early on. Food jags was mentioned earlier too, with regards to I eat the same food all the time, and now I don't eat it at all. These are called food jags, and they can be very dangerous, especially if your child has much fewer foods in their current diet. As you start losing foods, you realize just how challenging this could be. So we want to avoid that as best as possible, and we try and give you tips and tricks and strategies to addressing this. Sometimes early on, we won't mess with any of their current core foods because we're worried that food jags will eliminate food from your child's diet altogether. So a professional working in feeding and eating, like OTs and speech and language pathologists, can really support you in working on how do we bridge the foods that they're eating to other foods without really messing with the foods that they're eating currently, so they can keep them. Limited social interactions for your child and family. Right now, we know that there's a lot of limited kind of going out to restaurants and things like that anyway. But a lot of times when we see people, when we're visiting friends or things like that, it's around mealtime. And if mealtime is challenging, I'm not going to seek out those things. So older children who are dealing with this, or older adults who have experienced limited feeding and eating, are certainly recognizing the effects that can have on them. And that's a big impact for the family unit. I can't take Jeremy to the restaurant because he won't eat anything. So we can't go. And that's really isolating and very upsetting. So we want to support you as best we can. We recognize that a lot of these habits are hard to break. And so the more we get ingrained in our habits and everyday experiences, the harder it is for them to be broken. So that's why earlier intervention is the best. If it's not possible, there's still lots and lots of support that can happen, but our progress just takes a little longer. And we know this, and we work with you and your family to kind of mitigating this as best we can, because we recognize changing your everyday routine can be challenging. And so we work with you to address these habits in a much more functional and hopefully successful way. I think, Kylan, this last one is for you.
Hylan, you're muted.
It would help if I would unmute. It's been a long day, as I'm sure all of you can relate to. So we have lots of things to think about, right? There's so much great information here. So think about, what is your child independently willing to do? What will they do if you just give them the food? Do they touch the food to their lips? Do they put it to their teeth? Will they touch it with their tongue? Will they chew it? Will they take a bite? All goes back to those thoughts that Nikki threw out at us that are so great, because now you can look at your child eat and think about, you know what, he did take a bite of that, or he smelled it and then he threw it, or he squished it with his hands first and then said yuck. So you can kind of look at how they're eating and figure out how they're exploring the foods. Do they play with the foods? What do they do? So I think kind of the moral of the story is play with food. It goes the opposite from what our parents grew up teaching us, was to not play with your food. But for our kiddos that have difficulties with their feeding, we want them to feel comfortable. We want this experience to be good for them, so let's make it fun. Play with the food. Don't be scared to make a mess. You can throw them in the tub. You can wipe stuff down. You can, put them in an area of the kitchen where you can cover it with paper, whatever you need to do, especially when Angela was talking about that more, exploration of the food versus the actual meal, right, where they're getting their nutrition. Don't be afraid to make a mess. Explore textures in a non-forceful way. So a ton of my kids, and Nikki and I share several kids, that I have noticed have made the most progress are the kids where we have gotten parents to understand that when they take away that pressure and they don't say those things like, take a bite, try it, you'll like it, it's good, eat it, and they push it in their face, or they try to give it to them on a spoon, and they just leave it and walk away, even if it's safe, depending on the textures, right, and depending on your child and their skills. Even then, if they leave it on a plate for them to come back to, or even if just during the mealtime, they don't even draw as much attention to it and push for them to eat the food, the kids really start exploring it. They feel more comfortable. They don't have those demands constantly placed on them. I love to have a safe plate, or I've been lately calling it a goodbye plate, or a bye-bye plate. So having a separate bowl or a separate plate where you can just kiss it goodbye, goodbye. And I do that, and you would be shocked at how quickly kids will just kiss the food goodbye when before they wouldn't even touch it, right? And then you've gotten it up to the lips, and you've got to win for the day, right? So making a safe plate or a goodbye plate where if there's something they don't like, oh, okay, can you help me put it in the goodbye plate? You know what? You don't have to eat it. Let's just put it in the goodbye plate. And then next thing you know, the kids are touching the food. There you go. You're at that first crucial step. Try to match foods to those your child is eating already. Again, Nikki did a great job of explaining this. If your child is already eating chicken nuggets, then maybe you try for dino chicken nuggets. Slightly different, also very fun to play with because they're dinosaurs. And you can make up all kinds of fun games with these dinosaur nuggets. If they'll eat Cheez-Its, maybe the next thing to do is to try a different, orange cracker, right? So just thinking of how you can introduce something that's slightly different, either in color or texture, and try to match it with what they're already eating so it's not as scary, right? That's how we eat as adults. We tend to gravitate to things and places that we know and we're comfortable with. And then, we start to branch out based on things that are closer to things we already eat. And eat with your child. You are their very, very best model. I always tell my families, number one, you are the expert on your child. You will always be the expert. You will be the expert more than any doctor, any therapist. You know them better than anyone. And so you being with them and eating with them and modeling how to play with the foods and modeling eating the foods is going to be just monumental in their success. So play with the foods. Don't be afraid to make a mess, and really think about how your child's eating and how you can make this experience more pleasant for everyone. And so thank you so much, everyone. Thank you so much for coming. Thank you so much for choosing to spend your evening with us. And we hope that we were able to give you very valuable information that you can take with you. Please continue to follow us. Go to MeBeFamily.com. Follow us on Instagram and Facebook. Like Nikki said, we are always posting things. It is our goal to help you feel successful and help your child feel successful. So please reach out to us with any questions that you can or that you have. And then I believe some people were asking Katie about the presentation, about a copy. Do you have information about that?
Yeah, I do. Thanks. I did. I think you guys did an amazing job. First of all, we've got lots of compliments in the chat box. So thank you so much for all of the information that you shared. And I will send out a follow-up email tomorrow that will include the link to the recording so that you can watch it again if you ever want to, or share that with other people. And I will also send you a copy of the actual presentation with the slides too, so that you have that for reference. I know one person said they wanted to share that with their doctor. So, maybe that can be something that they can use as a way to have that conversation with their doctor too. So I think that's a great idea. So that should be coming to you in your email inbox tomorrow. And I think we've got some questions coming in. While we look at those, I am going to just ask you for one more poll here, one more poll question, just to give us some feedback, because we do like to do these MeBe Learning webinars. We want to make sure that we're providing information that's helpful and useful to families. So the question here on your screen, is thanks for attending the webinar. How helpful was the information that you received today? And any other feedback that you have, please, you can put them in the chat box or the questions. We are happy to get your feedback, and it's very helpful to us as we continue creating these webinars for our families. And so I'll get everybody a chance to do that, and then we can look at the questions. We're getting some thank yous, so thank you again to you guys for providing us this information. Let's see, so we had a question come through about how it's usually, the therapy is usually funded. Is it provided through insurance? I don't know if somebody can address that question, maybe Nikki.
Yeah, we do take, feeding therapy is covered by some insurances. It does depend on your insurance plan. So every single plan is different. If you are interested in feeding therapy, you can always contact us, and we are able to run your benefits to see if that is a covered service for you. But you can also call or contact your insurance company directly. If your insurance does not go through, it's something that we don't take. We do take commercial insurances. You can always go through a local hospital as well. So just because if you can't come to us doesn't mean these services don't exist somewhere else as well for you. So it is important to figure out what your plan covers. So I would really recommend contacting your insurance first to see where you're able to go. We are more than happy to help you with that process as well.
To add to that too, Nikki, thank you. That's really helpful. Depending upon what specialty you're getting to, if you're looking for occupational therapy or speech and language pathology, that's dependent as well. So in OT, we don't always need to delineate the difference between occupational therapy services and feeding. For speech and language therapy, you may. So this is what part of that too, what Nikki's talking about is there's some coverage challenges that you want to make sure that we can avoid. And you can always call us. We have our family success liaison who can help support you with any of those questions too. We know that sometimes insurances aren't always fully helpful, or sometimes the information can feel conflicting. And so that's why we have some people dedicated to help you through that process.
That's great. We did also get a question about providing feeding therapy in the Los Angeles area. So I know you mentioned the telehealth option, so maybe you want to talk a little bit more about telehealth.
Yeah, we do telehealth in Los Angeles, so it just depends on your insurance agency. So that is something I would recommend contact us. If you are interested, telehealth is a fantastic model for feeding therapy. I know that we went into feeding therapy, and often with telehealth, it was pushed into with the pandemic that is going on. We will continue to do feeding therapy telehealth after, I don't know when after will be, but like continue, even if things get better and people do start going in centers more frequently, we will continue this model with telehealth. We will often try to push in-center and telehealth because of how great telehealth has been. We've made so many changes with our kids just being in their own home setting with the parent there to be able to watch and help with them. It really kind of increases that parent participation. It's very easy to drop your child off at therapy and have the therapist take them back, and some therapists prefer it and some kids don't participate with you there in therapy, but in your home setting it's very different. So if you're interested, we do telehealth within the Los Angeles area and a variety of areas. So if you have friends and they're in a different state and they have said, oh my gosh, my kid he's really picky, but I think it's like more than picky, I don't really know what to do, you can always have them reach out to us. We are constantly getting new licenses in different states to be able to help. So feeding therapy and telehealth has been fantastic. So we would love to be able to help you.
That's great. Okay, perfect. I don't see any other questions or chats coming through. We did get some more thank yous, so thanks again for all the information that you provided tonight. And look out in your email inbox for the follow-up email tomorrow with the link to the presentation and the recording. And with that, I think we'll sign off. We'll say good night. Enjoy the rest of your evening. Thanks for joining us.